So now let's proceed with chamber enlargement. So first, let's go to the most commonly enlarged chamber in the heart, which is the left ventricle. So in typical cardiomegaly, or in most cases, it's usually the left ventricle that's prominently and obviously enlarged on chest radiograph. So here are two radiographs, one of a normal chest and the other of a patient with cardiomegaly. So what we can see is that if we take the cardiothoracic ratio, this will be obviously above zero point 0.5. And you have to look at the contour of the left ventricle. We know that the left ventricle is border forming. So here it's bulging, and we can estimate the cardiac apex. It's around this area. So if you compare it to a normal radiograph, the cardiac apex will be situated around this area. So what happens is that there is inferior and lateral displacement of the cardiac apex. So that is one clue that the patient has LV cardiomegaly. So I mentioned earlier that we can see a slope here that will help us identify if there is left atrial enlargement. So there is none. That slope is still preserved. So this is your typical LV cardiomegaly. No other chamber is enlarged. So now I'd like to quickly look at the vessels, and it's of normal caliber. So we see this tiny donut, which is your um, airway, and more or less it's the same size with its accompanying artery. So that is normal. So there's no congestion yet. But we have an enlarged LV shadow. On lateral view, so this is the one I was talking about, that there is a sign um, that will help us identify LV form cardiomegaly on lateral view. That is the Hoffman-Rigler sign. So we have to identify two anatomic structures, your inferior vena cava and your left ventricle. So we form two lines. From the inferior vena cava, we draw 2 cm above it. And from that level, we measure this line. This is measurement A in this image. So the normal is below 1.8 millimeter. If it's more than that, then it's enlarged. So this diagram was taken from a study done at Heart Center, and they tested how accurate the Hoffman-Rigler sign is in detecting LV cardiomegaly correlated with 2D echo. And sure enough, it has a very high sensitivity and specificity for detecting left ventricular enlargement. So what's important to note is, again, your film must be taken in true lateral, like in this example. So the vertebral bodies out, the outline of the vertebral bodies must be clear, and your ribs should superimpose with each other on both sides. So this is a perfectly taken lateral view. Now let's go to left atrial enlargement. So for the left atrium, this one has the most number of signs, and it's fun because they appear as a combination of each, and it can be easily seen in in radiographs. So this is a typical example of left atrial enlargement. And now, as I've mentioned earlier, you look at this area, the upper part of the left cardiac silhouette, and it's convex outward. So this is obviously an enlarged left atrium. So what other signs can we look at that there is an enlarged left atrium? One is splaying of the carina. So this one. So a normal carina would appear like that. So splaying means that it's widening. The angle is usually more than 100 for it to be called splaying, more or less. No? And we also have double density sign. Look at this area here, central portion. It's much more dense than this region and this region. So that's because of your enlarged left atrium that's superimposed with the other chambers, creating a very dense um, appearance in the central part of the cardiac shadow. So again, this is your double density sign. This is the left atrial margin and your right atrial margin. So we don't normally see a second contour, second border forming or silhouetting um, curve here on the right side. And again, this is another example, we have splaying. In this example, the angle is 102 degrees, and your left atrial appendage is also prominent and pushed outward. Another sign that you can look at is to measure this line. So it's taken from the midpoint of the left mediastinum bronchus towards the edge of the left atrial margin when you have a double density heart. So that's a prerequisite to measuring this line. And if it's more than 7, that's another sign of left atrial enlargement. So how many signs did we look at? 1, 2, 3, and 4. So those are at least 4 signs on frontal radiograph. Then there's one more sign on lateral radiograph. This is your walking man sign. So it's created by the trachea and the bronchus. Left mediastinum bronchus and right mediastinum bronchus, which forms the legs of the walking man. So here's the, just use your imagination. Again, radiology makes use of a lot of imagination because it's just purely, most of the time, it's just black and white, and we have to make do with what we have. And here, the one causing that walking man sign is again your bulging left atrium. So here its shadow is extending and superimposed on the thoracic spine. So the walking man sign is basically your splaying of the carina on frontal radiograph, seen on lateral view. So it's the same sign. And this is the one also that's creating the double density. It's the density of the heart and the enlarged left atrium. Next sign is RV enlargement. Look at signs of RV enlargement. So on frontal radiograph, we look at the pulmonary conus. Usually it's prominent on RV. And opposite to your left ventricular enlargement pushes your cardiac apex inferolaterally, while for right ventricle enlargement, it's pushed upward. So your apex is here, and this is what we also call as rounding of the cardiac apex. So this is the also one the one that's responsible for creating your boot-shaped heart in the trilogy of Fallot. So the tip of the boot is the cardiac apex that is upturned. And as I mentioned earlier, you also have loss of the retrosternal space because of the enlarged right ventricle, which is border forming on lateral view. Mhm. So this is the one I was saying. It's comparison. If it's right ventricular enlargement, it's upward turn and rounding of the apex. If it's left ventricular enlargement, it's downward and lateral. So those are the signs of chamber enlargement. Now, if you've noticed that I didn't discuss on right atrial enlargement, typically there are no obvious radiographic signs of right atrial enlargement, but as a general rule, if your right ventricle is enlarged, most often the right atrium will also be enlarged.